Hello, everyone. How is everybody doing? I am Dr. Anshul Gupta, and welcome to our Thyroid Thursdays. Nice to see everybody over here. Uh, Looks like our chat section is not working for some reason today. Oh boy, that's not good. I'm trying to see if we can fix it. Apologize for that. For some reason, like the chat section is not working and I don't know how to fix it. I hope you guys are able to hear me though, so that we can at least do the session today. So, yeah, so I don't know. As for some reason, the chat section is not working. I cannot see all of your comments and all of your information. So, that is a big bummer. I don't know what happened, why the YouTube is doing this. Um, but yeah, I mean, still, we will add value to our session today. We will cover some questions which people have already posted. But unfortunately, I will not be able to take any live questions because it looks like the chat section is not working for whatever reason it could be. But yeah, welcome to our Thyroid Thursdays lives, where I try to answer as many questions as possible that people might have had, and what things we can do to improve their issues and problems. So that's what I will try to do for you guys today also. So we have some questions that people have already posted. So I'm going to first go over with those questions, and then after that we will try to cover some other questions that people have already posted before and see what can be done about them. So let's try to get pulled up some questions. We are going to still wait for people to join us so we can get going. I'm just kind of messaging also my tech team to see if they know how to fix this live session thing, the chat section. But yes, so welcome over here, guys. So today, as I said, I'm trying to try to cover as many questions about thyroid, mainly Hashimoto's, but also kind of a lot of people have seen more interest in inflammation piece of it. So I'm going to cover some information about inflammation for you also, what you can do to improve it. And then what we will also do is that, in the future, I'm planning to do a master class on inflammation. We have done some master classes on thyroid. I hope you already know about it. But then we are also going to do some master class on inflammation. Maybe next couple of weeks, I'm preparing the master class where I'm going to give you a complete blueprint of how to lower inflammation, because inflammation is one of those root causes which is there for anybody who has issues, whether you have thyroid, whether you have Hashimoto's, whether you have rheumatoid arthritis, whether you have weight issues, whether you just feel tired, whether you feel bloated, achy, the underlying issue, all of those things is basically the inflammation. So that's what because a lot of people have set us questions about how to tackle inflammation. So that's what I am going to do for you also, of addressing inflammation in the future for you also at some point of time. Otherwise, yes, keep posting in the comment sections in terms of future what things you would like to get covered, and we will try to kind of post our like information about live session beforehand in the community section, so you are aware of it and you're able to post questions so that I can cover those things for you. All right, so I think I will get started over here. So let's get see what people have posted. So one of the questions that people have posted over here, which I think I get a lot, is that whether thyroid antibodies can interfere with a female's chances of becoming pregnant and also continuing pregnancy successfully till at the end. So actually, a lot more females are having issues being with conception, and they're not able to conceive things properly. And then so that is the case. Just give me a second. Uh, So it looks like the chat section is working. My assistant is able to see those chat sections. I am not. So I'm just going to ask him to post those questions to me personally in our email. So, guys, and you guys can post your questions in the chat section. And my assistant is going to email me. And then this is the way we are going to do a workaround this time of the chat section. Okay. So please, yes, I cannot see the chat section. Don't know why, but he can see it. So please post the questions in the chat section and we will try to get those also. Okay. All right. So the question about whether the thyroid antibodies can affect the chances of conception of or pregnancy chances. Yes, it is true because there is a big rise in unexplained infertility of people, also called as an autoimmune infertility issues. What that means is that all the testing is done of the females as well as of the males and everything comes back to be normal. The females fallopian tubes are working, they are completely normal, uterus is working, they are making eggs, but they are not getting pregnant. The reason being the body is inflamed and has this autoimmune antibodies which is not letting your body, even the eggs and the sperm, when they ovum, they are not letting that ovum to fertilize and conception to happen. So very common thing which happens, and a lot of females are not even aware of they have Hashimoto's disease. So I tell any female who is trying to be pregnant, or who has been told that there is some issues with pregnancies, then I tell them, just don't check your TSH, go ahead and check the Hashimoto's antibodies too. And there is a very high likelihood that those antibodies might be high for you and that might be interfering with the conception chances. So, yes, make sure that, make sure that you're getting your thyroid antibodies checked. And plus, if you are trying to conceive, then work on those antibodies to reduce it, and that can definitely improve your chances of conception as well as continuing a successful pregnancy. Because another problem that happens when the thyroid antibodies are high is miscarriages. A lot of females will go through early miscarriages and not able to continue pregnancy for full term. So once you work on those antibodies, once your Hashimoto's is better, then your conception is definitely, chances are much better that way. So that's one more reason to work on those thyroid antibodies, because they not only destroy your thyroid gland, they destroy ultimately all of your body parts. So it starts with your brain, like starts affecting your brain. That's the reason a lot of people will get brain fog issues, because their brain is affected with these antibodies. Then it is going to affect and damage your adrenal glands. That's the reason people will feel tired, as well as they will have no energy. Plus, damaging to your mitochondria also causes this. Then it causes issues with your gut. Okay, damages your gut, these antibodies, and leads to issues with constipation, bloating, gas, again because your gut is affected. Then it also affects your brain hormones like serotonin, norepinephrine, adrenaline, and all those things. That's the reason you'll have mood swings, feeling stressed out, feeling anxious, depressed, low mood. So that's the reason these thyroid antibodies, very important to understand that they're not only destroying your thyroid gland, literally destroying your body from head to toe approach. And unfortunately, the thyroid hormone medicine you're taking is not doing anything for these antibodies. I hope you know this by that this time. And that's the reason the symptoms do not get better by taking the thyroid medicine, because these antibodies are not lowering for you. Okay. Okay, so that's the question. Then let's go to the next question over here. Now, the next question is Meera Garodia has this question. Is it safe to take T3 medicine with T4? Okay. Thyroid medicines. Okay. So, the most common medicine everybody's taking is levothyroxine, okay, which is a completely T4 medicine, right? Now we have access to something called T3 medicines also. So basically, the reason being T4 is an inactive thyroid hormone which needs to be converted to the active T3 hormone in your body, right? Some people, that conversion is not happening from T4 to T3, and doesn't matter how much levothyroxine they take, whether it's called Tyronorm, Synthroid, or anything, that doesn't get converted to T3. So that's the reason people do not feel better. So sometimes, yes, combination of T3 and T4 works better for those people. So absolutely, you can try that. But the other problem is that a lot of people are doing high doses of T3 medicines. At least I have seen 10 to 11 patients in the last 1 year where their functional medicine doctor has started them on a very high dose of T3. They feel good, energized initially, but they start feeling worse. Their energy drops, their mood gets worse, they are always on the edge, they're always feeling anxious. All of these are sign or symptoms that you are taking too much T3, and you have to kind of lower the dosage. Okay. The other thing, which is the approach that I take, is that improving the conversion from T4 to T3. Okay. There are certain things that you can do to improve the conversion from T4 to T3. There are certain nutrients. One of the nutrients is zinc over here. Okay, zinc helps in conversion of T4 to T3, and selenium is another mineral which helps the conversion of T4 to T3, plus magnesium. Okay, so these are the things which helps in the conversion of T4 to T3. Then the next thing which helps is working on your toxin levels. Everybody is toxic, right? Because we are exposed to toxins day in, day out, each and every day. So toxins are in our environment. There is no way, doesn't matter how clean you are keeping, your home, still your body does get exposed to toxins. And thyroid patients are specifically very sensitive to toxins, so that's the reason a detoxification protocol is very important, that will help to get rid of those toxins and improve the conversion from T4 to T3. Okay, so yes, you can take T3 medicines, but if you can improve the conversion from T4 to T3, that will be the preferred way to go, and that will be a better way to go. That okay. So all those minerals which I told to you about, that's what you can do. If you I hope you guys are already aware that I've made this thyroid supplement, which is a specific supplement which has all of these nutrients. It has the selenium, the zinc, the L-tyrosine, it has a little bit of ashwagandha, it has some B vitamins. All of those things are added to it, that not only improves your thyroid antibodies, but improves the conversion of T4 to T3, plus also increases your thyroid hormone production. So try that supplement. If you try it for 2 or 3 months, you will see an improvement in all of your thyroid numbers. So the link will be like in the chat section, so to kind of take that supplement to help improve things for you. Okay, so that's about the T3 and T4. Okay, then the next question I think Stephanie has is that how to cure hypothyroidism without goiter in children. Okay, so again, the concept is not very different, whether it is a child, whether it is an adult. Okay, because they both have similar pathology. We didn't used to see Hashimoto's or thyroid conditions, like a decade ago in children. It was mainly middle-aged females. But each and every day, parents are reaching me out that their child has been diagnosed with thyroid disorder. So it is very common these days. Okay. So concept is very similar, that you have to work on the underlying process of the root cause approach is what I talk about. You have to identify all of the root causes and work on all those root causes. Until you do that, your antibodies, your thyroid numbers are not going to get better. Okay. So working on that root cause approach is what I propagate, and through my research is what I found, that that is the only way where a person's thyroid can get better. Whether you have symptoms or not, whether your TSH is under control or not, that is irrelevant. You have to work on those root causes so you can not only improve your thyroid but also safeguard your body from any further damage that those thyroid abnormalities does to your body. Okay, so that's what you need to do. The root cause approach focuses on five major root causes. Okay, so there are five major root causes which is causing thyroid disorders and also inflammation in your body. One of them is food sensitivities. Okay, now more and more people are becoming more sensitive to different kinds of food. We know about gluten, people know about dairy, people know about soy, corn. So these are foods which we are getting more sensitive to, because these are very highly genetically modified food which is present in our environment currently. So that's the reason, we get very inflamed with taking them. They causes gut dysfunction, what we call as leaky gut, and that ultimately causes thyroid disorders. So very important to work on food sensitivities. The second is obviously toxins. Each and every thyroid patient that I work with, or autoimmune cases I work with, definitely have some kind of toxins in their body, whether it is the mold toxins, whether it is heavy metals like lead, mercury, arsenic, or it is environmental toxins like BPAs, which is the plastics, or pesticides or glycosates that might be present. They are going to be present, destroying your thyroid and your immune process. So identifying and working on those toxins are very important. That's the second root cause. The third root cause is what I call as adrenal dysfunction or stress. Each and every person, before they get diagnosed with autoimmune diseases like thyroid or Hashimoto's or rheumatoid arthritis, I ask them every time, what was happening in your life a year or close to before diagnosis? And they all will invariably say that there was some kind of stressor in their life, whether it was emotional stress, you went through some, like personal stress, relationship stress, or work related stress, or just stress of having a baby, or stress of getting into menopause, or stress of just kind of hormonal dysfunctions. Any kind of stress, definitely will cause adrenal dysfunction and ultimately leads to thyroid disorder. So working on your adrenals and your stress is very important. That's the third root cause. The fourth is chronic infections. Okay, whether it is gut related infections like parasites, whether it is infections like bad bacteria called SIBO in your gut, or bad candida infection, which is also called SIFO, or you have Lyme disease or co-infections. All of those things will cause thyroid issues or autoimmune disorders. Epstein-Barr virus infections, COVID infections, other kind of viral infections will also can lead to this. Okay, so you have to work on the immunity of your body to make it much more stronger and also get rid of these infections. Then only your body and thyroid is going to get better. And the last one is deficiencies. Okay, our body is deficient into specific vitamins and minerals, like how I was talking about selenium, zinc, magnesium, iodine, vitamin B's, vitamin D's. All of these are very important to keep our thyroid and your immune in check, immune balance in check. And most people who have a thyroid disease or autoimmune disease or Hashimoto's will have this immune system broken down, and that causes definitely their diseases. So very important to work on replenish these vitamins and minerals. So very important to that. So these are the five major root causes which are leading to any kind of autoimmune diseases, any kind of thyroid diseases, and you have to work on not just one, not just two, but all of the root causes. Okay, and this is a common mistake almost each and every of my patient that I have seen makes. Oh, I'm already doing this diet. Oh, I'm already taking this supplement, but things are not getting better. Well, you have not worked on a complete root cause approach. Just making few changes to the diet, just taking some supplements, if that is going to treat thyroid disorders or autoimmune diseases, that is not going to be possible. You have to work on all of the root causes, address them one by one to complete levels. Then only you will be able to reverse your disease. So very important to work on all the root causes approach. So start doing that today itself. Yes, good thing is that you can make few changes on your own by following a good diet, by working on your stress management regimens, taking certain supplements like some of the thyroid bundles that we have put out, which has all of these different kinds of vitamins, minerals that can support your journey out here. So definitely you can start using those along with some lifestyle changes and see what improvements you see. If you see even a 10% improvement, that's a big thing, because now working on a couple of root causes, you see that great improvement. Now imagine if you start working on all of the root causes, then bingo, things starts working really great. So actually, I just interviewed one of my patients just recently, Maria, and her video is going to come out. Her interview going to come out, I think next week or so on my podcast, and hopefully on our YouTube channel. I would like you to see it. But basically, she was a health coach. She already was on a health journey. She was actually training, to run on marathons. So she was very healthy. She was eating the best and the cleanest diet. She was taking supplements, and still she got Hashimoto. She was told to take medicines, and even by doing certain protocols, her antibodies actually got worse. Just imagine doing everything right from your own end, but still her antibodies got worse. She was feeling worse. And then when she saw me, the first question she asked me, "Hey, Dr. Gupta, what difference are you going to do? I'm already doing a diet. I'm already taking certain supplements. So what is difference? That's what you are also talking about doing it." So I told her it is not about doing a diet. It is not about taking a supplement. It is about doing and addressing all of the root causes one by one. Then your antibodies are going to get better and your symptoms are also going to get better. And this is exactly what we did. And bingo, her antibodies, I think those were like 1600, came down to 800 within few months. Her doctor did not believe it. They said they never come down. So she had to change doctors actually to find a different doctor to order that test to repeat those antibodies, which came down lower, like, almost half, and they had never seen it. Her some of the symptoms, improved significantly, and she was feeling so good. So that's what I tell people, is that first of all, there is hope for things to get better, but you have to do the right things. Hashimoto's and other autoimmune diseases are complicated. You need to follow certain protocols, take certain supplements in a stepwise manner, then things get better. Okay, so let's go. So let's answer some of your more questions over here, okay, and see what we can do. Um, Um, Somebody mentioned in the chat section, Ishal Farooq, I follow your instructions and my TPO antibodies are low. Wonderful. Great job. Like, this is what I want to hear, is that getting those antibodies to go lower. And, it's not happening in one person. Several thousands of people are able to lower the antibody. So, yes, you can do it also. Okay. So definitely, I'm so glad that you are putting in the work and you're seeing the results. So that's great. Joy has this question: can having thyroid problems cause fat or swelling all over the body? Yes. This is what we call as bloating. This is basically another sign of inflammation in the body. And thyroid and inflammation go hand in hand, right? That's the reason I'm so big proponent of working on inflammation for thyroid patients, that this swelling and inflammation is not going to get better, or bloating is not going to be better unless you work on the inflammation. So definitely, please work on your inflammation. Very, very useful for you to do that. Okay. um, so please do that. Somebody has this question: is there a connection between hypothyroidism or low thyroid and high cholesterol? Absolutely, yes, there is a connection. Because again, what is cholesterol? Cholesterol is an inflammatory molecule. Whenever inflammation rises in your body, your cholesterol is going to go high also. So basically, it's a protective molecule for your body, so that that inflammation doesn't damage it. But because you are not helping your body to lower inflammation, that's the reason cholesterol is rising up high. So very common with hypothyroidism to have high cholesterol issues. So address your underlying issue of inflammation in the body by following the diet, by following the supplements, using inflammation related supplements, which includes like boswellia, turmeric, curcumin, ginger, quercetin. All of those are great supplements that help lower the inflammation. I hope you know that we have created this special supplement called Inflammapro, which has all of these different inflammation reducing substances into one capsule. Again, will be link will be there. You can buy it if you want to, or otherwise you can just use them separately also. Okay. And I think that's where the question was: as is turmeric good for thyroid? Yes, turmeric is really good. Turmeric has curcumin, and curcumin is one of the most strongest anti-inflammatory substance that we have. So definitely curcumin is very, very useful. The problem is that regular turmeric is good for health purposes, but when you have a disease, then you need high doses of turmeric or high doses of curcumin. And if you take too much turmeric in your food or just as a spice, then it upsets your stomach. So that's the reason in supplement form, we are able to extract that curcumin from turmeric, and we can use high doses. So that's what, it works better that way. Okay. So that's great. So that was the next question. So Carol has this question, which is very, very common thing, that having signs of Hashimoto's disease, the whole healthcare team is not doing any treatment right away. Okay, so that's a very common thing. You will go to your doctor. Oh, your thyroid antibodies are high, but your thyroid numbers are fine. Go home, just chill and relax. Come back in 6 months when finally those antibodies have destroyed your thyroid gland. Then I'm going to give you this thyroid medicine called levothyroxine, which is going to save your life. So just imagine, actually, they are basically giving you a death sentence that you have these thyroid antibodies, nothing can be done, and ultimately they are going to kill your thyroid gland, kill your body, and the only thing you need to do is that watch, right? Not do anything, watch, which is absolutely wrong. As soon as you find you have thyroid antibodies, you need to start working today so that you can lower those antibodies. Without lowering those antibodies, your body is not going to get better, and your thyroid is not going to get better. Okay, so that's the reason it is very important for you to lower those antibodies, work on them. Because ultimately, as I said, they're not going to destroy your thyroid gland, they are also going to destroy your body. So work on that, and there is a chance that you might not even have to go on medications, because you might be able to completely reverse it. Okay, so so that's the case. So let me see what more questions we have. Alrighty. Let's see. Okay. Somebody has this question, I have hypothyroidism, but I want to drink chai tea once a day. Is it fine? Well, so chai tea, has does have milk into it, and we don't propagate dairy, because dairy is very inflammatory. Now, the reason being is that the dairy which is being produced today has a lot of chemicals, lot of hormones, lot of different things which are added to it, and that's the reason it is not good. So, dairy, a lot of my patients, once they remove dairy, they will see significant improvement in their gut, in their antibodies and things. So that's the reason we want to avoid dairy. So yes, your regular chai tea will have dairy into it, and I like to do that. So stay away from it as much as you can. That will be really good for you. Okay, you can do black tea. In that, green tea is good. But I don't know if you guys have seen my latest recent video where I'm sharing that green tea is great, but this another thing which I found, the yerba mate, is actually much better than green tea. I knew about it, but I never looked into the research, and that was the best thing. I started looking into the research, and yes, the yerba mate has much more beneficial compounds as compared to green tea, and that's what I recommend my patients to drink these days. Available world over, very easy. So that's what you can do instead of the green tea or even black tea. Definitely, yerba mate will be good. Help you to lose weight. Will have more antioxidants, so helps to reduce inflammation much more than the regular green tea. So work on those things, and I think that will be useful for you. Okay, let's see. Somebody has this question that I have both thyroid and rheumatoid arthritis, and my anti-CCP is 1200. Can I conceive? Well, obviously you can conceive. I'm not saying that people cannot conceive, but I'm just saying that if you're unable to conceive, then you know that the reason is an autoimmune process. Okay, of both rheumatoid arthritis and thyroid, and your numbers are really very high of autoimmunity. So definitely, first thing, my recommendation will be to work on this autoimmunity, lower those antibodies, so that your body will thank you and your child will thank you that you had a very nice pregnancy that way. So that's what I can say that. So that's great. So let's see. I think Ankita has this question where can get the consultation. So basically, we are a completely virtual practice. We see people from all over the world. So whether you are in US, UK, Europe, India, Asia, anywhere you are, you can get a consultation with us. Go to on our website, and then they will have information over here to fill the form, or you can send an inquiry to us by that form of that you are interested in working with us, and my team can get more information to you. Okay, so that's great. Let's see what else is there. um, some people have this question about how to treat asthma and things. So those are very difficult things, asthma and things. For that, again, you need to work on your immune process. A couple of things which has worked for my asthma clients is that using quercetin, because quercetin works on your, especially on your respiratory tract, and that can be useful. The second thing which works is tulsi. So tulsi is an Indian plant, and that has some chemicals which actually opens up and improves your breathing potential. So tulsi green tea are also available, so you can use that for your asthma, which can be useful for you. And then quercetin is useful, and vitamin C is useful. And then going on a strict anti-inflammatory diet of removing all the things, especially dairy, gluten, soy, corn, caffeine, alcohol, sugars, definitely is very important to treating the asthma piece of it. So that's great. Okay. So that's good. Spencer has this question. What do you think about ablation? Thyroid ablation, like okay, most of the time, thyroid ablation is recommended if you have a thyroid nodule, or let's say if you have a tumor in your thyroid, or the thyroid is really big. It is fine if that is being required. But like obviously you can do other things to improve these situations also. But again, it depends on why we are doing the ablation. That's a bigger question. Okay. So Armin has this question: can premenopause be one of the reason to have autoimmune disorders? So yes, premenopausal period is a very important period. A lot of female hormones are fluctuating during this time, so that can also be the reason of this issue. So definitely that can do that. Like now, the perimenopausal period is an interesting period for a lot of females. The new research suggests that it can start as early as 35 years of age. Okay, that we can see some fluctuations of female hormones. And I shared with you, the fluctuating hormones in the body, people don't like, especially your thyroid don't like, and that triggers Hashimoto's disease. So definitely that can be the reason. So get your hormones checked. But again, working on your hormones is again working on the underlying root causes. That again helps to rebalance your hormones too. Zishan has this question: what are the causes of leaky gut? How to find out the root causes? Well, that's a difficult piece, right? I hope that I had a magic answer to it of how to find the root causes. That's where working with a functional medicine provider is the only way to know all of your root causes. But like if you want to work on all of the 4 or 5 root causes I mentioned over here, that is another way a lot of people will do it. So that is something that you can do that too. There are testing available, advanced testing available, that can check all of these root causes for you. That can be done for people. Advanced testing of looking at gut microbiome, advanced testing of looking at toxins, advanced testing for adrenals, advanced testing for hormones. All of those are available. But yes, like it's difficult to get those testing done. But yes, like if you do those testing, then that can be like looked into. Okay, Robin has this question. Any studies whether any thyroid disorders resulted from COVID vaccines? That's $1 million question. Nobody's going to publish that research. As soon as you talk about vaccines, those, especially the negative effects of vaccines, they don't get published. So I don't think we are going to get ever that kind of research. But anecdotally, I can share that yes, we have had seen patients who have had COVID disease, and they were diagnosed with Hashimoto simultaneously. So that is the case. And then, does berberine cure Hashimoto's? Well, unfortunately, one supplement cannot cure Hashimoto's. Whether it is me or anybody else, if they tell you that one supplement is going to cure Hashimoto's disease, that will not happen, because as I shared with you already, that root cause approach. So unless you do that, then only cure is possible. Does berberine help Hashimoto's? Yes, it does help Hashimoto's, but it cannot cure it. Now let's talk about berberine, right? A lot of people are using it. I've shared a couple of videos about berberine too. So berberine is actually improving your insulin sensitivity. So it works by two mechanisms. It improves your insulin sensitivity, plus it works in your gut and rebalances the gut microbiome, because it also helps to kill the bad gut bacteria in your gut. Okay, so that's what the berberine does. So that's the reason berberine is really good that way of using it. A lot of people use it for weight loss, but it can also be used to rebalance your gut. It can also be used for kind of improving insulin sensitivity. We do have some case reports where berberine was able to lower the thyroid antibodies. So that is something that can be done. Okay, so that is the case. Okay, Zishan has this question. My TSH is 15, testosterone is low, TPO is high, no dairy, no soy. 40-year-old, why is this so high? TSH so high? Well, I told you, right? This is just not about the food. No dairy, no soy, no gluten is good, but that is only solving one root cause. What about all the other root causes, right? So you have to work on all of those root causes. How do you know you don't have toxins? How do you know that you're not low in zinc, selenium, omega 3 fatty acids, magnesium, vitamin C, and things? How do you know that your adrenals are working good, right? So that is, you do not know those things, right? So that's exactly what I talk about, is that working on those root causes approach is the way. And then if you want to find them out, your root causes, then yes, you have to do all of those advanced testing. That is a short way of knowing whether what root causes you have, and plus how bad are they, so that then that can be done. So yes, you have to find a functional medicine provider. If you want to work with us, we do provide online consultations, so we can do that. Or if you have a local functional medicine provider who specializes in Hashimoto's, then he or she can help you to order these advanced testing for you, so they can do that for you. Okay. So that's great. So wonderful. I think we're coming to the end of our session, but let me take a few more questions that just came to me. Um, so somebody says that, is DIM supplement useful for thyroid? Yes. So DIM is basically helpful for detoxification, and I was sharing with you, DIM helpful, especially is helpful for estrogen detoxification. Estrogen dominance is a major problem. A lot of females are going through estrogen dominance these days. That's the reason we have PCOS. That's the reason we have endometriosis, heavy menstrual period, dysmenorrhea, or acne. These are all signs of estrogen dominance. And DIM is a very great supplement that helps in rebalancing your estrogen and also detoxification of it. So yes, DIM is a good supplement that can help a lot of thyroid patients. Okay, let me take a few more questions, and then unfortunately we will have to close our session today. But again, I really want to thank you guys for joining us, sharing all this great information about you, what is happening with you. So it fills my heart with kind of all the love that you share for us. And as I said, we will keep coming for these live sessions on the regular basis, at least once a month. Hopefully, try to do much more than that, but at least once a month we'll try to do these live sessions. And as I said, I'm going to promise you, going to do a masterclass on inflammation. So keep lookout on the community section for that masterclass, so that you will know exactly how to tackle inflammation. Okay, let's see. This is interesting. Uric acid levels being high. Okay. So, uric acid levels being high, actually, a lot of people think uric acid being high is because of gout, which can be the case. But a lot of times, uric acid being high is also an indirect sign of inflammation being high in people. Okay. Because again, your body has different defense mechanism how to tackle inflammation. And we're talking about chronic inflammation, not acute inflammation, right? Whenever your body has a chronic inflammation going around it, it has defense mechanism. It increases your cholesterol so that it can fight that inflammation. It increases uric acid so it can fight inflammation. So uric acid is one of those things, which can cause inflammation levels in the body. And again, working on that would be obviously working on inflammation in your body. And plus obviously, like looking at seeing what foods, like especially red meats and alcohol also causes high uric acid, so make sure you're staying away from it. Okay, great. So can you send supplements to Germany? We are shipping supplements worldwide. Now every country has their own custom laws, and then obviously we don't know all the custom laws, so we can ship the supplements to you, but you might still have to deal with the incoming customs issues. So that is something that you guys have to deal on your own, but yes, we do ship worldwide. Okay, I think, guys, that's the end of all the questions that we can take today for you. I really thank you that you guys have joined us. Again, as I said, whenever we share in the community section about the new live session coming up, please post your questions over there. So it kind of gives me some time to prepare the right answers, and sometimes even able to research those questions for you. So kind of, yes, post those questions. If you have any further topics or any particular things you want me to cover in the future, again, share them. We would like to cover those as many topics as possible. We'll keep sharing new information which is coming out. I'm learning each and every day with the new research which comes out, and I would like to share with you new videos based on that research, so that you have some credible information that you can apply in your own life and get your health back. So again, thank you so much for joining us today. I really appreciate you finding some time of joining me, and I will see you next time in another session. Okay. All right, guys. Take care till that time. We'll see you next time in another session. Okay. Take care. Bye bye.